earlier version of this legislation to provide Coloradans with a new, affordable choice for health insurance. That turned out to be the last night that the legislature would be in session for a while due to the outbreak of the COVID-19 pandemic. And now we're back. And our resolve to make healthcare more affordable for Coloradans has only strengthened. And just as our public health prospects have thankfully improved since last year, so has this bill. It now provides the healthcare industry with a chance to bring costs down. It protects providers that see a high number of Medicaid, Medicare, and uninsured folks. It brings more transparency, and it promotes more public participation. And Coloradans want this policy more than ever. When polled recently about the concept presented in this bill, 66% of Coloradans expressed support, including 76% of Latinx Coloradans and 78% of Black Coloradans. Coloradans are ready for a new day in our state, one in which people of all races and all income levels, wherever they live, can afford access to quality healthcare. Passing this bill would be a huge step in getting us there. Back over to you, Jarrett.
Thanks, Jake. Next up, I'd like to introduce our Lieutenant Governor, Diane Primavera.
Thank you, and hello everyone, and thank you for joining us here today. I'd first like to start by taking a moment to acknowledge our sponsors, Representative Roberts, Representative Judah, and Senator Donovan. I know how hard you all work. Also our partners in the private sector, the consumers, providers, small business owners, and advocates who are in attendance. And I just want to say right off the bat that there is so much great work being done by the legislature on the issue of saving people money on healthcare. And I want to thank you all for your hard work and leadership. Today, we gather virtually to mark the introduction of a bill that seeks to meet the pressing healthcare needs of Coloradoans across our state. We hear from constituents all the time, especially in our rural, frontier, and mountain communities, that healthcare is simply too expensive for families to afford. The introduction of legislation to establish the Colorado option marks a significant milestone in realizing the efforts of the Office of Saving People Money on Healthcare. But more importantly, it marks what we hope is the beginning of a healthier Colorado. Affordable and accessible health insurance furthers health and well-being and increases economic security for Coloradoans, their families, and their businesses. The Colorado health insurance option is a balanced approach to bring more affordable health insurance options in the individual and small employer markets. To be clear, the bill does not advocate for what people refer to in a simple sense as, quote, government-sponsored healthcare, unquote. Instead, the Colorado option provides an opportunity for industry partners to innovate to make healthcare more affordable with minimal government direction. The healthcare industry is spending $1 million trying to convince you otherwise. But even their big money ads and slick websites say that they believe that every Coloradoan deserves access to affordable, high-quality healthcare, and that they advocate for proven solutions that build on what's working and fixes what's broken in healthcare. They even say that they're committed to working together in this unprecedented time to ensure that every Coloradoan has access to the coverage and care that they need. Well, that's what this bill does. By offering insurance carriers the opportunity to negotiate to meet premium reduction targets, the Colorado option allows for private sector innovation and holds the unique potential to add competition to the market to deliver meaningful results. The industry itself has advocated for this approach for many years, and we are confident in their ability to come together and find market-based solutions for Colorado. But there is some accountability built into the bill too, because while we're confident that the industry can come together to lower costs, we can't just rely on promises. If the healthcare industry is not able to find a way to bring costs down while maintaining quality and access, the state will offer the Colorado health insurance option that is more affordable, is more accessible, and adds competition to the market. The COVID-19 pandemic has further demonstrated that everyone needs access to quality, affordable healthcare. Each of our health depends on everyone else's ability to access healthcare that they need. And the inequities in our healthcare system are stark. Black, American Indian, and Alaska Native, and other people of color are uninsured at a higher rate than the white people in our state. And 89% of those uninsured say the cost of coverage is the primary reason for lacking health insurance. These high costs are also a significant barrier for rural communities. A Colorado option means an affordable choice for residents who've been left behind by a lack of affordability and choice in our healthcare system. So as we build back stronger, we must continue the work we started to make healthcare affordable for all Coloradoans, regardless of who they are or where they live. So I look forward to working with you all this session to make good on our commitment to ending the pandemic with a better healthcare system for Colorado. Thank you.
Next, I'm going to turn things over to Dr. Kristen Nortonholtz, who is an emergency physician.
Good morning. My name is Dr. Kristen Nortonholtz. As an emergency physician, I'm reminded every day how barriers to our healthcare system make it harder for my patients to get the care they need. Every shift, I see someone who does not have access to a primary care doctor or cannot afford their medications. Just the other day, I admitted a young man to our intensive care unit because he could not afford the insulin he needed. That time it was insulin, but fill in any medication. Blood pressure medications, anti-seizure meds, psychiatric meds, the list goes on and on. Lack of access to critical medications due to financial barriers lands people in my emergency department every day, and some require expensive admission to the hospital. Many Coloradans worry about being able to afford their medications. Many worry about their health insurance premiums. Many forego healthcare altogether. COVID-19 has further exposed the failures of the Colorado healthcare system. 6,000 Coloradans have died. 400,000 Coloradans have gotten sick, many with possible long-term health challenges. Thousands of Coloradans have lost their jobs. And along with the job loss, they've lost their employer-provided health insurance. The Colorado option is an opportunity for Colorado to lead the way, protecting families. The Colorado option will make healthcare more affordable for my patients and for all Coloradans. Patients should be able to access a variety of options for affordable insurance. The Colorado option is another option, another choice to get more affordable healthcare. Nobody should have to choose between seeing a doctor, putting food on the table, or getting their medications. The Colorado option can help families avoid making impossible choices. We know that individuals who see a doctor when they need to are more likely to get the care they need when they need it and follow up for that care when they should. It's better for them, but it's also much better for our communities, especially during a pandemic. The Colorado option will help our patients afford the care they need to live and thrive. Please join with me in supporting this bold plan to provide affordable health care across all of Colorado. Thank you very much.
Next, I'd like to turn things over to Noelle Emerson, who is a healthcare consumer in Colorado.
Good morning. My name is Noelle Emerson, and as an educator, I am often sometimes deciding on if I need to even spend the money for my health care. Many times I will put things off because I just can't simply afford a scan that may cost $500 to $200. I can't afford that in my classroom, and I can't afford to take away from my student. Many times I have also decided not to invest in my future with wanting to buy a house, with wanting to save money, or even take care of my student loans. I can't afford that as an educator because my deductible is extremely too high. And then when it comes to having to pay for medication, because I do have extreme allergies, sometimes I'll take 2 Benadryls instead of paying the deductible. So also as an educator, there have been times where I am afraid to even go to the doctor, just afraid of the price that I may have to pay. So with this bill that we are talking about, I would really like to see this not only help me, but also help my colleagues who are also struggling with affording our medical expenses. Thank you.
Thank you, Noelle. Next, I'd like to turn things over to AshleyHenshaw, who is a business owner.
Hi, my name is AshleyHenshaw, and I am the founder and co-owner of a small business, Stepping Stones Learning Center of Littleton. We provide care and early learning to infants, toddlers, preschoolers, in addition to private kindergarten and school-age enrichment programs. Our community's workforce quite literally depends on the health and reliability of our staff. I currently have a staff of approximately 26 individuals who are talented, diverse, and deserve to have health care. Since the start of the pandemic, the urgency to provide healthcare has quickly intensified. Health insurance for our staff is too important to ignore anymore. The way the healthcare system in Colorado works does not help small businesses like mine protect our most valuable assets, our employees. For the first time since we opened over 2 years ago, our center enrolled in healthcare just this week. This decision was not easy to make. We are not a large corporation with endless resources. Providing healthcare is expensive, and the Colorado market offers little to no options. More competition, like in any industry, would benefit small businesses and help us afford healthcare for our employees. I know that having health insurance isn't the only solution. For too many people, the insurance their employers are fighting to provide also comes with out-of-reach deductibles and costs. This leads to people putting off care and not getting the treatment that they need and deserve. For us, the Colorado health insurance option alleviates these concerns. It infuses desperately needed competition into the market, reduces insurance premiums in the small group market, and lowers out-of-pocket costs for consumers. It's a win-win for small businesses and our workforce. We should not have to make the decision between sustaining our business's viability or promoting a talented employee and paying for their health care. Simply put, we need the Colorado health insurance option to make small businesses more competitive. We're at a market disadvantage for recruitment and retention because we do not have the same advantages in the insurance market to purchase the best plans. The Colorado health insurance option will even the playing field. As a business owner will tell you, healthy workforce is only as productive. As a business owner, I will tell you that a healthy workforce is only productive if their workforce is productive and healthy. My bottom line and my business depends on my team being healthy and high performing. By supporting this bill, lawmakers are supporting small businesses, our employees across the states. Thank you for your time.
Thank you. Next, we'll turn to Stephanie Salazar Rodriguez, who is a healthcare consumer as well in Colorado.
Hello, my name is Stephanie Salazar Rodriguez, and I live in Denver. Like many Coloradans, I rely on my employer-covered health insurance for many years. The problem is what happens when you lose that insurance, and I'm here to shed a little light on that. While I still have limited income from consulting work, I recently lost my employer-sponsored insurance because of the economic impacts of COVID. I had to consider whether to buy insurance on the marketplace or go through my employer insurance through COBRA. At the age of 64, either of those two options comes with exorbitant rates and is requiring me to pay nearly $1,000 a month for health insurance coverage. And I'm slightly above the threshold for tax insurance credits. However, $1,000 a month is nearly 1/4 of my income, and the financial burden is not sustainable for any length of time. This puts me in a very difficult financial situations and means I must make some trade-offs that will impact my total overall health wellness. I will not be able to pay out-of-pocket expenses for urgent dental work. I may need to euthanize one of my canine companions because I cannot afford the veterinarian care. I may even lose my vehicle or my house. Between the cost of my mortgage and my health insurance, I expend 60% of my monthly income on two imperative expenditures that ultimately may necessitate that I max out my credit cards or lose my health insurance. As someone who has advocated personally and professionally for people to enroll in health insurance and get the care that I need, I now find myself struggling to afford the health insurance that I need in the midst of a pandemic. For people like me and many other Coloradans, it is vital that we take action to reduce and control health insurance costs. I didn't expect to find myself in this situation. Nobody does. And the options that I have are simply not affordable. While this legislation may be too late for my situation, the Colorado option will reduce and control costs that many Coloradans like me desperately need. Thank you so much.
Next, we'll turn to Kevin Holmes.
Hello, my name is Kevin Holmes. I'm a doctor of physical therapy and I live in Aurora. While I could talk today about my job as a healthcare provider, I'm unfortunately here to talk about my challenges as a patient in our healthcare system and the high costs that have made my wife and I put our dreams on hold. Our lives have been controlled in more ways than one by the cost of health insurance and the cost of healthcare, even with that insurance. In 2019, I suffered an injury playing with my dogs, of all things, and now I need major hip surgery. We've been saving for more than a year to try to cover the costs of surgery as well as the opportunity costs of me being without a paycheck for months. With the high cost of living in Colorado, student loans, medical bills we're paying off for mother care, we're struggling to the point where we can afford surgery, and that is with health insurance. To top it off, my wife was unable to work for 5 months because of the birth of my son and COVID racking our economy. Our luck still doesn't seem to get better. And in fact, I'm losing my employer-based insurance this month. While I will be able to go on to my wife's insurance for a time, we ultimately want to start our own clinic, which would require us to purchase insurance through the individual market. While the high cost of insurance and the out-of-pocket costs we are facing have forced us to delay our plans, forgo buying our home, and more, I want to have hope. This is why I'm speaking out in support of the Colorado option today. The current cost of insurance, the cost of care with that insurance, they're all out of control. The Colorado option will make health insurance and out-of-pocket costs we face more affordable and allow us to take care of our health and move our lives forward.
Thank you, Kevin. Next, I'd like to introduce Representative Dylan Roberts, the prime sponsor of the Colorado health insurance option.
Thank you, and good morning, everybody. Thank you for joining us. And thank you to our Lieutenant Governor for joining us, and as well as Dr. Nortonholtz, Noelle, Ashley, Stephanie, and Kevin. Thank you for sharing your stories on why this bill is so important. I am Dylan Roberts. I'm very proud to be here today alongside my friends, colleagues, and co-prime sponsors, Representative Aman Judah and Senator Kerry Donovan, to introduce our bill to lower health insurance costs in our state. Wow, today has been a long time coming, and I'm very happy to be turning this long talked about idea into a bill. I know that for everyone speaking today, healthcare is very personal. And as legislators who represent both rural Colorado and diverse communities, we carry an extra burden of representing constituents in our state who are the most deeply impacted by high health insurance costs. For me, the two counties that I represent, Eagle and Routt, there is only one option on the health insurance market for those who buy on the individual market. And those premiums are some of the highest, not only in our state, but in our country. For a family of 4 who lives in Gypsum, Colorado, in Western Eagle County, for example, the price of a yearly insurance plan can be close to $40,000. Or for a small business owner in Steamboat Springs, buying a healthcare plan for their employees is simply unrealistic because of the cost. Because of this, my area of the state that I have the privilege of representing has an uninsured rate at an alarmingly higher amount than the rest of the state. That is not acceptable. And that's why I've been working alongside Senator Donovan and others for years to do what we can to help bring lower costs and more choices to the market. We believe that this bill will do that. And after significant changes from last year's bill, I'm confident that we can get it done this year. Addressing the root cause of rising healthcare costs is the best way to provide long-term, affordable, and quality healthcare for all Coloradans. Our number one priority for this bill, as it has been since we first introduced it last year, is to provide cheaper care for all Coloradans. And that goal has not and will not change. But we are coming forward with a new, innovative, and collaborative 2-phase approach to this issue when we introduce this bill. Throughout the stakeholder process last year, many in the healthcare industry asked for an alternative approach to lower healthcare costs and expressed a desire to be a part of that solution. This year's proposal will take them at their word. The healthcare industry repeatedly asked for the opportunity to lower healthcare costs themselves as an industry and provide cheaper care without compromising quality. So in phase 1 of this proposal, the only thing that the state will do is set a standard for a standardized quality health insurance plan and give them a goal for premium reduction. No government mandates, no requirement to participate, But if they want to, they will have the next 2.5 years to achieve a 20% reduction in health insurance prices by the end of 2024. We welcome and thank the already excessive collaboration and welcome collaboration amongst our hospitals, carriers, prescription drug manufacturers, and we will give them more time and space to negotiate amongst themselves without government interference to achieve reductions if they want to. I think this is a necessary first step, and we're hopeful that this approach will provide long-term relief for working Coloradans and small businesses. If it's successful, the cost savings in the first phase will not only help Coloradans covering themselves and their families, but small businesses who purchase on the small group market. And additionally, this proposal creates a standardized plan, which will expand pre-deductible services, streamline coverage, and lower outrageous out-of-pocket costs. However, if the industry cannot or will not meet the goal and decides not to participate, then it is our duty to offer to find another path and offer a lower cost plan. That is why this legislation has a stopgap measure if phase 1 is not successful, and that is phase 2, which would be the creation of the Colorado health insurance option. The second phase of the bill will create the Colorado option to lower costs and offer a cheaper insurance product alongside already existing products on the market. The Colorado option will offer real competition in the individual and small group market, something that is badly needed in many parts of our state. In phase 2, we would create a nonprofit entity that will offer the Colorado option with the same standardized plan design that was created in phase 1 at an affordable price, and it will be available to consumers who purchase on the individual and small group market. Nobody is forced to buy this Colorado option plan, and it's paid for without raising taxes. It's simply just a new, affordable choice that Coloradans deserve. I believe this new approach gives us every opportunity to succeed. If phase 1 is successful, then we all benefit. But just in case it's not, we have phase 2. I've heard and read from some people who say that now is not the time for bold, necessary reforms like this bill. And all I'll say is that those individuals have not spent enough time with the constituents that we represent, who are paying some of the highest premiums in the state, and making decisions right now as to whether they should go another year without the security of health insurance or not. I am very proud of this proposal that will be turned into a bill this afternoon, and I look forward to the work ahead and the legislative process that we will go through. And I look forward to getting this bill signed into law. Thank you.
Thank you, Representative Roberts. Next, I'll turn things over to the prime sponsor in the Senate, Senator Kerry Donovan.
Good morning, everyone, and thank you so much for joining us today. Good morning by just a few minutes. And thank you, everyone, for sharing your stories today. That is a hallmark of my experience of the past 6 years of advocating for healthcare. Is every story presents a different challenge of what it means when healthcare is too expensive for people to afford. And so thank you for those who joined us today for lending your voice to this cause. And thank you for the Lieutenant Governor for kicking us off, as well as the advocates who have worked behind the scenes on lowering the cost of healthcare for people across the state. For the last 6+ years, I've had the privilege of representing Senate District 5. It's a big district. It's spread across the high country and Western Slope. One of the things that makes my Senate district so special is how diverse it is. From our ski towns in Eagle County to our farms and ranches in Delta, from Leadville to Lake City, our work, our politics, and our struggles vary. But no matter where I go in my district, there's one challenge that folks agree have reached a breaking point. That's that they can't afford their health care on the individual and small group markets. Year after year, I hear devastating stories when I'm at a coffee shop or I'm knocking on doors from my constituents whose lives have forever been altered because they need and their families can't afford the care that they so desperately are entitled to. Or perhaps paying for that care that saved their lives bankrupt their family. For decades now, the prices have gone up, leaving many Coloradans behind. For the 1 in 5 of us who struggle to pay for healthcare or who make the devastating choice to go without care entirely, the current system that protects profits and not patients just isn't working. We can only solve this problem by confronting it and the system that perpetuates it head on. That's why I'm so proud to be here this morning with my co-sponsors and some of our incredible community partners to help you introduce you all to the Colorado option. We refuse to accept that there's nothing that can be done to challenge the status quo. As legislators, it is our job to find solutions, even when at sometimes that feels impossible. Colorado, especially our mountain and rural communities, have some of the highest cost health insurance in the country. And this has been true now for over a decade. 90% of uninsured Coloradans say that price is the reason that they don't have insurance. And every Coloradan deserves access to high quality, affordable care. And this plan will help us get us there. Our constituents rely on us to embody the same resilient spirit that they do, to come to the table with bold ideas that will make the lives of all Coloradans better. And the Colorado health insurance option is just that. It is a bold, targeted, and thoughtful approach, and is our best chance in years to increase access and lower the cost of healthcare across the state for everyone. This isn't about imposing government mandates on the industry or forcing anyone to give up healthcare that they already have and like. It's about asking the hospital systems and insurance companies to join us at the table and work together to find solutions to this problem that has persisted for far too long. Right now, like so many times before, Colorado has the opportunity to lead the way for the rest of the country and prove that affordable healthcare for all can be a reality. And I'm really excited to start on that journey today. Thank you.
Thank you, Senator. Next, we'll turn things over to Representative Iman Judah, who is the co-prime sponsor in the House.
Thank you. And thank you for everyone who's joined us this afternoon, as well as everyone who has been brave enough to tell us their own lived experience and story about why this is important. For me, I decided to join this bill because of my own lived experience in healthcare and being underinsured and uninsured. And also to simply support a bill that at its heart will keep people healthy at a time that is more urgent than ever. I want to make this point clear. The Colorado health insurance option will help all Coloradans, including all people of different races and socioeconomic backgrounds. I'm no stranger to being the target and on the wrong end of misinformation because of the community I grew up in, the color of my skin, my religion, or my heritage. So let me address some of their concerns and the claims head on. They claim that this bill will completely change the current way we provide health insurance. And again, a lot of these ugly campaigns and claims are coming from corporate healthcare CEOs that have already started their misinformation campaign. And many of these claims are untrue, just like the one that it will change our health insurance. This bill gives the industry 2 years to work from within the current structure to lower healthcare costs. In phase 2, the Colorado option will deliver in the existing marketplace just at a cheaper price. These negative ads have also claimed that this will increase health insurance premiums. This is simply untrue. The industry doesn't need any helping out on that point. Our proposal specifically includes cost reduction targets. It's as plain as the ink on paper. Lastly, they have made wild claims that this will harm communities of color, Black, Brown, Indigenous people, and this is also very untrue. And I want to be very clear about this. Decades of systemic and institutional racism in healthcare have hurt communities of color. Black and Asian Coloradans are nearly 1.5 times more likely to be uninsured than their white counterparts. Latinx and Native Coloradans are uninsured at 2.5 times the rate of white Coloradans. The uninsured rate tripled for Latinx children in Colorado between 2017 and 2019. Communities of color are burdened with more medical debt than white people. On average, 31% of Black Americans have past due medical bills. These outcomes have haunted communities like my own, not just recently, but for decades. And those that benefit from these inequities have cried foul because this proposal actually lowers costs. And let me make one other thing very clear. The emergency room is not healthcare. The emergency room is only for emergencies. The emergency room should not be a place where primary care is given. No one should have to go to the ER because they don't have insurance or have delayed their care to the point where it does become an emergency. Built into the Colorado option are significant provisions aimed at increasing equitable access for quality health care in Colorado. I want to say that again. Equitable access for quality health care in Colorado, especially for BIPOC communities. By simply insuring more people, especially BIPOC communities, everyone wins. Clinics and hospitals, especially located in BIPOC communities, will get paid for their services because more people will be insured. And they will have quality insurance plans. And the people will have access to these plans. And having access to equitable, quality healthcare plans that actually covers the services and procedures they need is healthcare equity. This helps them continue to go to the hospitals and clinics in their neighborhoods, in their regions. I also want to take a moment to talk about the positive impact it would have on small businesses. In my district, HD 41 in Aurora, one of the most diverse cities, not only in Colorado, but in the United States, I'm proud to say that many BIPOC individuals have small businesses, and many of them want to grow their businesses. They want to be able to have the option to offer health insurance to their employees, but they don't have that option currently, and it's making it difficult for them to grow their businesses. The other day, a friend of mine who is an immigrant and a person of color told me that he really wants to grow his business, but he can't do that because he can't afford to attract the right talent, which requires offering a healthcare plan. We as lawmakers have an obligation to give our small businesses this opportunity to contribute to our economy, to grow, attract the talent to Colorado we need, and we should be doing this for BIPOC communities. This bill does that. I was not afforded this luxury as a child. My father, an immigrant and a refugee from Palestine, a small business owner, didn't have this option. He didn't have the option to offer healthcare to his small business employees. And at 15, when I was diagnosed with my own pre-existing condition, I remember my mother writing a check for $350 for a 15-minute specialty visit. This is not equitable. Had we had this option as small business owners, as people of color, as immigrants and refugees, as people who call Aurora home, I would not be stuck with this generational trauma, just as many BIPOC community people are. And I want to fix that. I want to thank you for your time, and I want everyone to know that I am also just as eager to work on this bill, work past the noise and the falsehoods to deliver a promise that we all campaigned on, that healthcare is a human right, and that affordable, sustainable, and accessible healthcare for all is what we should accomplish. Thank you so much for joining us.
Thank you, Rep. Thank you, Rep. I think next we're going to turn over to questions from the press corps. I know I see a couple folks with their hand raised, so if you could please raise your hand if you're interested in a question. Please direct your questions to a specific either sponsor or one of our other panelists here. We'll go first to John Frank from Axios.
Yes, hi, thank you. This is a question for Lieutenant Governor. I'm wondering whether you would be willing to negotiate with insurance carriers and hospitals who believe some of these benchmarks in the first 2 years are too hard to meet. They say they're unrealistic. How open to you are you to negotiating lower benchmarks that would make it easier for them to meet?
You know, I would like the bill sponsors to weigh in on that, because there may be more detail in the bill that I'm familiar with, but we do believe that this is the balanced approach to bring more affordable health insurance options to Colorado. And it does give the health carriers an opportunity to work together with hospitals and pharmaceutical companies to, lower the healthcare costs. So we believe that, there is room for negotiation, but I will turn it over to Senator Donovan and Representatives Judah and Roberts if they want to talk more about the specifics in the bill.
Thanks, Lieutenant Governor. John, thanks for the question. It's a 10% reduction. So I think we've always been willing and will continue to have an open door to keep working on the policy as the bill moves through the process. But it's a 10% reduction and then a 10% reduction, which we feel is a realistic and thoughtful goal while still providing that cost savings for our constituents.
Thanks. Next, we'll turn to a question from Marianne Goodland from Colorado Politics.
Thanks very much. Can you hear me? Hi, this is for the sponsors. The bill allows for the addition of health benefit mandates throughout the 2-year period, which increase costs, not to mention the governor has already told lawmakers he doesn't want to see any more benefit mandates. The industry is telling me that this sets them up for failure, that it creates a moving target, that while they're supposed to be reducing costs, the legislature is adding costs. How do you address that?
I can take that one. Thanks, Marianne. So we believe that, again, we're asking for a really reasonable reduction in prices, 10% in 23 and 10% in 24. And then if we get to, if that's accomplished, then we'll just hold steady there, and then they can actually increase prices as changes occur with inflation and otherwise. We've addressed a lot of those concerns as well in the new bill draft that was released last night and will be made formally into a bill today. And we think this is fair. We will continue to talk to stakeholders if they want to provide alternatives to the benchmarks that we're setting right now. So the bill, may look differently by the time it reaches Governor Polis's desk. But this is a realistic target. And again, we think appropriate given the high costs that people are having to pay right now.
Thanks. Next, we'll take a question from Jesse Hughes.
Thanks for not answering my question.
Yes, can you hear me?
We can hear you now.
Okay.
Sorry about that.
Great. No sweat. So my question is for Representative Roberts. You said that the bill would not increase taxes. So I'm just curious to know where the funding for this comes from.
Yeah, great question. So the bill language expressly states that moving to phase 2, if we ever do move to phase 2, is contingent on the state receiving a federal 1332 state innovation waiver. These are dollars that are already coming to Colorado, where if we're able to achieve cost savings, we can use those funds we can innovate those dollars. And so that is what will be used to set up the nonprofit entity that would offer the Colorado option if we get there. If we don't get that waiver, and I'm very confident we will, but if we don't, then phase 2 wouldn't move forward because we have a commitment that we're not going to put this obligation on the state general fund and certainly not raise taxes, as that would of course require a vote of the people under Tabor. So it's paid for by the federal dollars and the monthly premiums that the customers would pay every month to the nonprofit, just like people pay right now to a private insurance company.
Thank you.
Next, we'll go to Jensen Worley of Denver Business Journal.
Hi there. I'm hoping you could just walk us through how you selected that 10% and then 10% figure and the math and thought process that went into that.
I can take that one too. So this bill actually, this whole process started several years ago. Senator Donovan and I were co-prime sponsors along with Representative Mark Catlin to pass House Bill 19-10004. That's the bill that kind of kicked off this whole process and directed the state to undergo a study and analysis of how to bring a new affordable option into our state. Part of that was an actuarial analysis that determined that we could reduce health insurance prices by about 9 to 18% year after year, and still maintain the quality of care in Colorado and not disproportionately harm providers. And so that's where that number came from, that if we're looking between 9 and 18% a year under that actuarial analysis, we actually chose the lower end of 10% a year and combine it to get to the 20%. So it was based in the actuarial analysis that was produced by a bill passed 2 years ago, a bipartisan bill.
Next question from Scott Franz of KUNC.
Thanks. Yeah, this is a question for the bill sponsors. I'm hoping you can talk a little bit more about the thinking behind the timeline and, giving healthcare providers until 2024. There's been a lot of talk about, the urgency of this issue. I'm just wondering, for people on the West Slope that have been paying higher premiums each year, what's your message to them for why take a risk and wait for a couple of year deadline to lower prices and not just try and enact something now?
I'm happy to talk about the Western Slope piece, because I do appreciate, particularly with your picture of the sand dunes, highlighting that right for a decade, kind of the mountain communities of the Western Slope have had some of the most expensive prices in the entire country on the individual market. And then we've seen small group have those same trend lines. The stories that I hear, when I visit Basalt or chatting with people down in Gunnison, where we know a lot of people, because of the employment of resort communities, often don't have health care and tied to their employer. We don't have a lot of large enough employers where healthcare is an included benefit. So, when you're talking with folks, I chatted with a couple that were in their late 40s, and they were telling me how they were having this agonizing decision of which one of them was not going to get healthcare for the next year because they could only afford for one of them to be covered. This shouldn't be a decision that we ask our neighbors to make. So this two-phased approach is reflective of a lot of stakeholding conversations that we've had, where the healthcare industry said, we really think we can do this on our own. In response to last year's bill, that was one of the predominant themes that we heard over and over again. We can cut costs on our own. Let us do this. Don't mandate, this. And so we really want to take them at their word, because a cost reduction is a cost reduction, right? I mean, our constituents just want more affordable, more accessible healthcare. They don't necessarily care about the manner in which that happens. So this bill is really trying to say, we'll give you two years to stick to your word and see if you can bring down the cost of healthcare by 10% and then 10%. A 20% reduction would be really meaningful for people. But because this issue is so urgent and such a burden on people having a quality of life and having access to healthcare, we're going to say if at the end of the 2 years you can't meet those targets, we're going to have something in place that will meet that goal of reducing the cost of healthcare and having more options to every corner of the state. So that's why you see this two-phased approach this year. We're really proud. We think this is a really innovative way to achieve healthcare savings for everyone by saying you got 2 years, do it on your own. We'll be cheering you on from the sidelines. If we can't get there in 2 years, then we're going to have an immediate solution in place because we know that people can't continue to wait for a reduction in healthcare costs.
I will also add, the same questions being asked on the Western Slope. Who in our family is going to get coverage? Can we afford coverage? Do we have equal access to this coverage and quality coverage are being asked in the urban corridor, especially in places like Aurora and in BIPOC communities. And this gives me pause because, again, I truly believe that healthcare is a human right. And we shouldn't have to question the quality of healthcare and the accessibility to that quality of healthcare. Even for folks who can afford to have some form of insurance, get junk plans. And when they need to use that insurance, they realize that they're not covered for the services or procedures that they need. That is not equitable access. And oftentimes it is that BIPOC communities that are on the brunt end of that inequitability. So when I think about this timeline, I'm also thinking about COVID, knowing that many of our hospitals, clinics, and providers are frontline workers, giving them this opportunity to work it out, to meet this percentage and discounted rate for folks in Colorado will allow them the opportunity to continue to be competitive providers and insurance companies in Colorado. But for me, I also want to highlight that lowering premiums, giving them the chance to lower their own premiums does in fact equal access for BIPOC communities to healthcare. If BIPOC communities have a chance to pay lower premiums, lower prices when they need healthcare and services, knowing that they're covered, that in turn means that that hospital and clinic has the ability to meet them, give them quality services, while doing it in a time where they're able to lower those premiums and costs and still stay in the neighborhoods that they service.
So unfortunately, and this is my fault, we've run quite a bit over. I think what we'll do is we'll take a final question from the Associated Press, and then for those who still have questions, we'll have to follow up with you later this afternoon. Please reach out to me and we'll try to get you connected as soon as we can with folks to answer those questions. So I'll turn things over to Jim Anderson from the AP.
Good morning, all. I was wondering what your latest estimates are in terms of the number of individuals who would be eligible under this program, as well as for the small group market, and kind of percentages they represent for the overall market here in Colorado.
Thanks for that question, Jim. So, and this gets to the funniness, I think, of all of these outrageous TV commercials that claim this is a complete takeover of healthcare in Colorado. It's simply not that. We're talking about the individual market, which is about 8% of the state's population. About 8% of the state purchases on the individual market right now, and about an additional 7% purchase on the small group market. So in total, we're talking about 15% of the state's insured population. Now, of course, there are people who are uninsured right now, and we do believe that by lowering insurance premiums in both phase 1 and phase 2, if we get there, we'll bring more people into the insured population. But that certainly is not a bad thing in our opinion. But at the end of the day, we're currently talking about 15% of the population, and our estimates show that maybe half of them would decide to purchase the Colorado option if we got to phase 2, and probably about half of them would stay where they are. So, less than 10% of the state's population, which it certainly means this is not a takeover of healthcare in Colorado, but it's a targeted approach at the people most impacted by high health insurance costs, which we know are the ones on the individual and small group markets.
Thank you. Is that, in terms of those percentages, is that state population or state residents who are purchasing on the health insurance market?
That's the current insured population.
Do we have a total figure on that?
I don't have that on the top of my head. I just know the percentages, but we can certainly follow up on that.
Thank you, sir.